I'm Dr. Kim Allenbaugh, and I have the privilege of being the current president of the Medical Society, and I thank you for being with us today. So, driven by our desire to positively impact young people's lives, we're here to announce an exciting collaborative effort. Joining me today, Joanna Haas, Executive Director of the Louisville Science Center, Marty Bonnick, Senior Vice President, Jewish Hospital and St. Mary's Healthcare, and Dr. Mark Slaughter, Chief of Division of Thoracic and Cardiovascular Surgery, Jewish Hospital, and the University of Louisville. The physicians of the Greater Louisville Medical Society are committed to improving the health of our patients, and many of Kentucky's young people are at risk for serious health conditions. As a result of poor nutrition and lack of physical activity, listen to this statistic. More than 1 in 3 children ages 10 through 17 are overweight or obese. In addition, in our middle school and our high school students, more than 1 in 4 are cigarette smokers. Obesity and smoking are 2 major causes of heart disease and other chronic medical conditions. So because of this, the Greater Louisville Medical Society is proud to announce our commitment of $100,000 to help launch the Pulse of Surgery program. By visiting the Louisville Science Center and viewing live heart surgeries, middle school and high school students will learn about the causes of cardiovascular disease. And by interacting with physicians and the surgical team in the operating room, we are hoping to motivate them to pursue careers in medicine. What we need to do is we need to recruit the next generation of physicians. As you know, in Kentucky, we don't have enough doctors as it is. We have 4 million residents and not enough doctors, and that's expected to get worse. So we are excited about this as a way to motivate students to succeed in their classes in science and to become the physicians of the future. Part of our mission of the Greater Louisville Medical Society is to advocate for the health and well-being of the community. It's what we do. So the Pulse of Surgery is a dynamic way for us physicians to teach, to reach out directly and teach young people, promote healthy practices such as regular exercise and good nutrition, while simultaneously encouraging them to pursue medical careers. So now, I'd like to take some time to welcome Joanna Haas from the Louisville Science Center to tell you more about this really exciting Pulse of Surgery program.
Thank you and welcome. At the Louisville Science Center, we are on a quest to convey that science is in fact everywhere, and that in some way, every day, every one of us does science. Today's announcement is another example of our work to bring science learning to the community in surprising ways. We're committed to our mission of being a statewide and regional force behind higher levels of science literacy. Like you, we know that the need is great. As we've heard, Kentucky struggles to employ enough scientists, physicians, nurses, and others in the medical field. Kentucky health statistics show a rapidly aging population coupled with high rates of chronic diseases, as well as youth populations that suffer increasingly poorer health from obesity, inactivity, and poor nutrition. Pulse of Surgery is designed to recruit new minds to the medical profession and also turn these dismal health statistics around. Pulse of Surgery will allow middle and high school students from all around the region and the state to engage in unparalleled anatomy and physiology lessons through real-time connection to the people and activity in a hospital operating room. Through broadband technology, students and the surgical team will see and communicate with one another. Along with a curriculum that emphasizes medical technologies and procedures, surgeons will show how lifestyle choices and changes impact the heart, and will discuss the educational paths that they followed to achieve their career goals. The program also includes a toolkit with real surgical instruments, journals to record thoughts and observations, supplementary visuals, interviews with physicians and other medical professionals, and pre- and post-visit classroom materials. We plan to launch Pulse of Surgery this winter and expect a minimum of 12 surgeries to be broadcast live in the first year. Pulse of Surgery is designed to increase science literacy among middle and high school students. These students are our future. They're our future doctors, medical researchers, and innovators across all science spectrums. Louisville Science Center is committed to helping increase their interest in pursuing science careers by energizing them and by connecting them with real science and authentic scientists in the field. And now I would like to introduce Marty Bonnick, Senior Vice President of Jewish Hospital and St. Mary's Healthcare, to say a few words. Marty?
This really started out as a vision that Mark brought to us, and we're grateful for that. And through the connection of Leadership Louisville, I met Joe one day, and we put these two things together, and this was just a perfect match made in heaven. And so we're so excited to be here and so appreciative to the Greater Louisville Medical Society for their donation to help get this program and turn this vision into a reality here in the community. And thanks to the support of many donors to the Jewish Hospital and St. Mary's Foundation, the Jewish Hospital operating rooms will be newly equipped with video equipment and cameras that will allow us to have a live feed from the OR straight to the Science Center. Dr. Slaughter and his medical care team will be able to perform surgery live and answer questions that students might have that are watching. And it's a truly interactive healthcare that would not be possible without the support of our foundation and donors. And I would just like to thank again the Greater Louisville Medical Society and the Louisville Science Center. We're grateful to have partners such as these great organizations who share the same goals we do in advancing education and prevention of heart disease. And now, without further ado, we'll introduce our star, Dr. Mark Slaughter.
Thank you very much, and I'd like to also, specifically thank the Greater Louisville Medical Society, certainly Dr. Allenbaugh, and then Jewish Hospital and St. Mary's Healthcare System. This really is a culmination of a collaborative effort. It really is a team approach. And the idea is, what could we do to help, prevent heart disease in Kentucky and improve the lives of teenagers and young adults as they sort of enter into what really is becoming a sort of a complex world. It's a lot different for them. They have access to many things that we didn't. Certainly their forms of entertainment have changed, and this has resulted in significant health problems for them, as Dr. Allenbaum alluded to. So there really were sort of two main goals for this. So one is a primary goal, and that is to try and help improve the overall health of the youth of Kentucky, to teach them good, healthy habits, and to hopefully prevent cardiovascular disease. Because still in the United States, cardiovascular disease is the #1 killer in adults. So part of the advantage of this program is, to read about it in books is one thing, but to see something live, to actually see a beating heart, to ask questions, has a much greater impact. It's very important that it's safe, which has been proven before, but it has a significant impact, and we hope to be able to measure that by going back and then testing the children, sending out questionnaire surveys, and looking for lifestyle changes that may have a significant impact, not only for the health of those children, but for the overall economic viability for the state of Kentucky. And then secondly, is that there's always need for talent in the healthcare field, not only amongst physicians, but also for nurses, physicians' assistants, nurse anesthetists, but the whole slew. And it's a national problem. And the problem is many kids and teenagers think that it's not an achievable goal. And when they have an opportunity to spend 45 minutes or an hour to ask questions directly in an environment where they're not uncomfortable, where they can ask things without being embarrassed, they realize that everyone in the room was just like them, and that no one was special. They just worked hard. They decided it was something they wanted to do. And it is achievable. So it provides a significant impact to give them a boost in the ability to realize that this is a dream or a vocation that they could also achieve. So I think it's a great opportunity, not only, for the Greater Louisville Medical Society and Jewish Hospital and the St. Mary's Healthcare System and the Science Center to promote the idea that this is what it's all about. This is what science does. It's education, it's teaching, and you start younger, the better. So I say it's very exciting. We have the ability to impact their overall health, to attract teenagers to an exciting field and vocation in the future. And I think it's a way to promote Louisville and the Science Center and the wonderful things they do. And it couldn't have been done without the collaboration of everyone here. So once again, I'd also like to thank everybody for coming. I think it's going to be a lot of fun. And I think over the years, we'll be able to measure the impact. And I think it will be very impressive. But thank you very much.